As Kenya joins the world in marking World Contraceptive Day, a growing crisis is unfolding in informal settlements. Advocacy groups warn that donor funding cuts have severely crippled sexual and reproductive health services, putting millions at risk. I visited Kibera, where nearly 10 months after key donor funds were withdrawn, programs like Dreams Owns a Lifeline for Girls have shut their doors. For 20-year-old Sophia Odor, the closure represents more than losing a clinic. It is the loss of a safe space, a vital protection against early pregnancies. Sophia had been a beneficiary of the Dreams program since she was 10. She credits it with helping her avoid early pregnancy, unlike her 3 siblings. With the center now closed, she fears becoming another statistic amid rising unintended pregnancies and unsafe abortions.
Alafu pia yenye pia niko na benefit ni hizo like unazaenda upate HIV testing ulikuwa nafanyiwa every year I think but unafanyiwa HIV testing, mnafundishwa mentorship hizi like girl to girl talk vile nafaa uishi vita. Mimi nasema tu asante cause ni mimi tu tuseme ni mimi tu kwetu ndio sina mtoto au wengine wako nao.
Teenage pregnancy rates currently stand at 15%, with a target to reduce this to 10% by 2025. For Ida Akoth, a former volunteer, Dreams was more than a job. It was a way of healing from her own childhood trauma.
I found it very hard to accept the fact that I won't be meeting with the girls again. Even if we meet just by the roadside, I just say hi, but not having that one-on-one conversation. And I was even thinking that, can I even just be calling them just one fine day and have a seat? Then I'm like, then what next? You know, I don't have, you need to have signed the child policy. Well, there's a lot you need to do for you to meet with children. You can't just meet with children. I need to be under an organization.
The Kenyan government has pledged 500 million shillings towards family planning, but advocacy groups argue this falls short of the required 1 billion Kenyan shillings, with the county already facing 3 billion Kenyan shillings funding gap. Collins Muchoki of Population Service Kenya warns that clinics are experiencing stockout of injectable contraceptives, limiting women's access to a full range of family planning options.
The problem with that is that even if other methods are available, we are actually limiting choice for our clients or our women. Yes, and for family planning, choice is very important because preference is key. And remember, no two methods are the same for a woman or how they treat them. So we need to have a wide variety of choice so that our women can choose what is most comfortable and convenient for them. So lack of choice is a very big problem right now due to the stockouts.
He also raised concerns about donor-funded components of the family planning ecosystem, such as data management, warehousing, and entering services, which now face uncertainty.
Something as simple as just messaging and so on have also been affected. For the reproductive health community or people who are in that space, there are these very important policy documents and guidelines that need to be revised. Some of them are now becoming outdated because we were very reliant on USAID money to actually do some of this work. We have the family planning policy that's in place, but it's not yet done.
The government, however, insists the situation is under control and is actively seeking alternative funders while engaging the private sector.
In our country, family planning products have always been like at sometimes even 70% purchased by development partners. And for some years, therefore, the budgetary allocators thought that is a place where we know the development partners are there, and therefore let's do other things. So now, it's now reverse.
According to the Ministry of Health data, 76% of women of reproductive age in Kenya need contraceptives, but 14% have unmet need. The government aims to reduce this figure to 10% by 2030. UNFPA has committed over 387 million Kenyan shillings to procure contraceptive commodities for 2025, but this will cover only 17% of the national requirement. Zainab Said for the Eastleigh Voice.